Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies at home, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home, otherwise medically complex clients, adults and children at home, which includes home BIPAP, home CPAP, home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium infusions, home IV magnesium infusions, and home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, and we also provide palliative care at home. We're also sending our critical care nurses into the home for emergency department bypass services, as we have done so in the past for the Western Sydney Local Area Health District, their In Touch program. So today I actually want to show an excerpt from one of my YouTube live streams where I answer questions live on a show to our clients and people that are interested in what we're doing. And I spoke to someone on the YouTube live that is in Trinidad, Tobago, and he's got his mom at home on a tracheostomy, and he really doesn't know what he's doing. And his life and his mom's life is at risk, and you will see that when I'm talking to him. So it's just another stark warning that, you know, you can never take your family member home without critical care nurses 24 hours a day, because that's what we do here at Intensive Care at Home by maintaining high quality standards, by being accredited. We are the only service in 2024 that has third-party accreditation for intensive care at home nursing in Australia. So without further ado, I'll let you watch the video, the excerpt when I'm consulting this client one-on-one. And there's a lot to learn for anyone who has a loved one at home, either on a ventilator and or tracheostomy. I'll be back soon. And now let's continue the conversation with... Hi, Ryan. Can you hear me?
Yeah,
Ryan, I can see your question. My mom has a tracheostomy long-term due to brainstem damage and inability to breathe on her own. Any advice? Ryan, is your mom also ventilated, or does she have a tracheostomy without a ventilator?
she has a tracheostomy without the ventilator.
Without the ventilator. Okay. How long has she had the tracheostomy for?
Since March, April, probably 2 to 3 months.
Okay. Where is your mom at the moment? Is she in hospital? Is she at home? Where is she?
She's home we have a nurse coming home to see about her.
Okay. And who's providing the care? Is it yourself or?
Yeah, well, I could say myself, yeah.
Right, okay. Is your mom mobile? Can she get up?
No. Due to the brainstem damage really came about, well, at least that's what the doctors told me, is from that she had blood clots in her lungs, right? And that apparently starved the brain for oxygen, leading to brainstem damage. That was the diagnosis initially.
Yeah.
And from that, they do whatever tests it is, conduct physical tests, and they came up that it's brainstem damage, and she more or less in a paralyzed state. She could move to some point, but on a bed. Right. She can't get up or anything like that. Yeah, she have some, how to put it, the inability to breathe. She was weaned off the ventilator. Right, so right now she just have the track without any type of ventilator, and they say that assisting her in breathing. So I just want to know if a track alone could actually improve your breathing or your oxygen levels in your blood. That is my question, really. That is my thing. Because having a track, I mean, she could eat nothing else wrong with her throat or anything like that. So
she is eating and drinking?
No. They say do not feed her because apparently, I don't know. All I not how to put it, I'm not too familiar with the track and how it is actually working. So they tell me that the doctors told me that I cannot feed her anything through her mouth, right? It's only through the tube, the feeding tube to the nose into the stomach.
Okay.
Because apparently, I don't know if the food does come out the tract through the throat, through the hole and the exit. Or the
Okay. Does she have a PICC tube?
a PEC tube?
How does your mom get nutrition if she can't eat and drink?
Yeah, the tube, the PEC tube through the nose.
Or she's got it through the nose?
Yeah, through the nose, yeah.
Okay.
And I usually pump the liquid food into the yeah.
Okay. Okay. How long ago was the original brainstem damage? How long ago?
That you could say in April. So
April this year?
April this year, 24, yeah.
Okay. How old is your mom?
53.
53? 53?
Yeah. She has bipolar as well, eh?
Yeah. Okay.
Yeah.
Wow. Okay. Where, if I may ask, whereabouts are you? Are you in the US or in Canada or
Nah, I in the Caribbean. This is Trinidad.
in Trinidad?
Yeah.
Right. Okay. Okay. So, few things here. Can she swallow? Do you know if she can swallow? Have swallowing tests been done?
She could swallow water.
And you do, and she's swallowing water every day?
Yeah, we give her a little teaspoon, just that's a kind of how the mouth moist, yeah, because you might get trash if you don't keep the mouth, moist and clean.
Yeah,
So we give her, yeah.
Okay. Okay. And she's not aspirating.
No.
And she has been cleared swallowing from the hospital.
She? Excuse?
So when you left the hospital, they have cleared her that she can swallow.
No. They say she cannot eat anything.
Okay. Okay.
Yeah.
What tracheostomy does she have? What size tracheostomy?
I think it's the cuffed, the small, the one with and that is the thing. I try my best to kind of educate myself on the track because I'm not too sure about it. They didn't, how to put it, they discharged her from the hospital without giving us a proper, how should put it, a proper review and explanation on how to care for the track and what is the purpose. They didn't give us all that. So I am like a total loss when it comes to that particular, yeah.
How long has she been at home for?
A month, 2 weeks.
Month. Okay. Okay. All right. So she's got a cuff tracheostomy.
Yeah.
Do you know the size? 6, 7, 8, 9. Do you know the size?
No, I don't know the size.
Okay. Have they given you some spare tracheostomies?
No.
Right. So the only tracheostomy you have in your home is the one your mom has in her throat. You have no spare tracheostomy.
No spare.
Okay. Okay. Is there an inner cannula? Do you know what I mean by that?
No, I don't know.
Okay. Do you change? So how often do you suction her?
From mucus, probably twice.
Twice a day?
Yeah, twice, depending on how much mucus we get in here.
Okay. Okay. And when you suction her, there's no inner cannula. I'll show you what I mean. If you give me a second, I'll just get a tracheostomy and I'll show you what I mean, because I think that is important for you to understand what I'm talking about, because this could be critical. Just give me 1 second, please.
Okay, no problem.
Just give me 1 second and then I will show you what I'm talking about. Okay, can you see that? That's a tracheostomy.
Yeah.
Right. So you've got the balloon.
Right.
Okay. And Just give me 1 second. I need to show you. So an inner cannula looks like this. You know, it comes in and out.
In and out? No,
You
no,
don't. That's
no.
not. You don't.
It's just
Have
open. Yeah, no.
Okay. All right. All right. Okay. That's fine. That's fine. So, who checks the balloon, and how often do you check it, if you check it at all?
We wasn't advised to check anything when it comes to that.
Okay.
They were just say maintain it, clean the mucus with the suction machine, and that was about it.
Okay.
So I just want to know the way forward, because we don't know.
Yeah. I'll show you that.
Yeah.
I'm still gathering information so that I can show you the way forward.
Yeah. No problem. Yeah.
Okay. So, how long ago was the tracheostomy done?
It was done April.
In April. Okay. How long ago did she come off the ventilator?
Yeah, April, May, probably. She came off the ventilator in May.
In May. Okay. Okay. So, and what about, is she incontinent? Does she use a catheter? How do you manage continence?
Yeah, she used the catheter and those things.
Yeah.
We have a nurse changing that regularly.
Okay.
And
Okay.
yeah.
All right. And basically, they send you home without any guidance, nothing.
Nothing. So
Wow.
yeah, it's a lot of trainee doctors, and they more in Trinidad here, they're more focused on critical patients, to the point that once they could revive the patient and dies a day, the families had to organize from there.
Very much
So
so. Very much
yeah.
so.
So once you live in, yeah, they may really have much
Yeah. Okay. All right.
much input, yeah.
Yeah. Okay. Does your mom cough? Does she have a good cough?
Yes. That is what's going on right now, and it make her real uncomfortable.
Yeah. Okay. Do you use nebulizers?
No.
Okay. All right. Okay. Do you know what I mean with a nebulizer?
Yeah, the kind of cleanse the air, or to help the breathing, or yeah.
Yeah. It's more about making sure that the air that she's breathing is moist.
Mm-hmm.
Because if she's only inhaling dry air, that puts the tracheostomy at risk of blockage.
Oh.
You are okay. So let's just, you asked me what's the way forward here.
Yeah.
So one of the problems here is, if the tracheostomy blocks, you don't have a spare tracheostomy, and the risk of the tracheostomy blocking is real.
Mm-hmm.
So the first thing that I would advise you is to get spare tracheostomies. That is the very first thing I advise you to get.
Okay.
Right? Because let's just run through a worst case scenario here. Let's just say the tracheostomy blocks. She can't breathe. You need to change the tracheostomy.
Yeah.
Right? And you don't have a spare one.
No.
So here's what you need to do. You need to find out what size tracheostomy she has.
All right.
Okay, let's just say, for simplicity, she has a size 7 tracheostomy.
Right.
Okay. You need another size 7 tracheostomy.
All right.
But you also need a size 6 tracheostomy, and here is why. Let's just say the tracheostomy comes out or blocks and you need to change it, right? And you can't get the size 7 back in. You need a size smaller to establish that airway.
Okay.
Am I making sense?
Yeah. Yeah. Exactly.
Okay. So that is the very first thing you need to do. You need to buy the same size tracheostomy and the size smaller.
And one smaller, yeah.
Okay.
Mm.
Now, there's a very high chance your mother has a Portex tracheostomy or a Shiley tracheostomy. There's a very high chance for that.
Mm.
And you should be looking on their websites, you know, where to get them.
Okay, so we could order this off Amazon or straight off your website?
You should be able to order them online. So it's often a Shiley.
Shiley, how spell that?
I'll type it in.
All right.
I'll type it into the chat pad. Hang on. They're the most common brand. There's other brands as well, don't get me wrong, but they're the most common brands. So I've just typed it into the chat pad. So that's number one. Number two, are you checking her oxygen levels regularly? Oh.
Yeah, sir.
There we go.
Yeah.
That's okay. That's okay. Right, Ryan, are you checking her oxygen levels regularly with an oxygen monitor?
Yeah. Yeah.
Okay. And what does that look like?
Oxygen levels, let's say approximately 90 to 93.
Okay. Does she have any underlying lung condition?
Other than the clots, no. She was on vaccine and those things for the clots and whatnot, and yeah, that is basically it in terms of any other underlying thing is the clots. Nothing else with the lungs. Nothing.
But what I'm asking, Ryan, is does she have an underlying lung condition, respiratory?
No.
Okay. Because 90 to 93, it's not very high. It's too low. Do you have oxygen at home?
No.
Okay. All right. It's too low, and I would strongly recommend that you get a nebulizer, a saline nebulizer. You can buy a nebulizer machine. You can buy a nebulizer machine at the pharmacy, probably at your local pharmacy, or online.
I have one at home.
Okay, I would start using it as soon as possible. How does your mom breathe? Do you have a humidifier?
No, I just have the air condition and that's it.
So the tracheostomy is open to air. You haven't got a filter.
Nothing.
So
just open.
Can you have a look at this? So the tracheostomy is open like this, like I'm showing you here.
Just so, yeah, exactly, yeah.
Okay. There needs to be a filter.
All right.
Right? And here is why. There needs to be a filter because an open tracheostomy is an infection risk. Massive infection risk. Okay. So you need to attach what's called an HME filter.
H&B?
I'll type this here.
Yeah.
HME filter.
Mm-hmm.
Okay. But you need to get a humidifier as a matter of urgency. You might have seen the humidifier in hospital.
The humidifier, yeah.
You need the same at home. So here is the risk, Ryan.
Yeah.
Without an HME filter or without the humidifier, the air will dry up.
Okay.
Right? Air will dry up and the tracheostomy will block eventually. That could cause a death for your mother. Your mom could die from that.
Wow.
Ryan, what you really need here is I will help you in the short term. What you need here, you need someone at home that can look after her 24 hours a day, that knows what to do with the tracheostomy. Your mom's life is hanging at a thread.
Mm-hmm.
But I will help you in the meantime what to do to begin with until you have you know, what you need to do in the short term. Now, other question. Do you have a resuscitation bag?
No.
Do you know what I mean by that?
Not totally, no.
Okay, I'll show you one. Just give me another second. I'll show you one. Just give me a second.
Sure.
So that I can show you what I'm talking about. Because again, this is critical. This is potentially critical for your mom's survival, right?
Okay.
Just give me a second. So this is, I'm not sure whether you can see that here. This is what a resuscitation bag looks like. And you might have seen it in hospital. Can you see that?
Yeah, see that?
Have you seen something like that in hospital?
I'm not familiar with it, no.
Okay. So basically, can you see that end here? Hang on, where is it? That end here, that will attach to the tracheostomy.
Okay.
And then you can inflate air into the tracheostomy in case of an emergency.
Okay.
Right?
Mm-hmm.
So really they've dumped your mom at home without any help whatsoever.
Exactly. Yeah.
So here's another thing. So I talked about the cuff, and I'll show you that again. Hang on, I'll show you that again. Just give me a second. I'll just need to bring up the tracheostomy again. Just give me a second. So, can you see that cuff here? The balloon?
Yeah.
You need to check that twice a day. You don't want it to be overinflated, but you also don't want it to be underinflated. But what you need for that is you need a cuff manometer. I'll type that in, right? Because what happens is this. If it's overinflated, your mom might end up with pressure sores in her throat. If it's underinflated, your mom is at risk of aspiration and saliva going into her lungs, ending up with an aspiration pneumonia.
Mm-hmm.
Are you following?
Yeah, I am.
Okay, all right. So then let's just run with the worst case scenario, because you really need to understand what you're dealing with. Let's just run with the worst case scenario. Let's just say the tracheostomy comes out and you can't put it back in. Okay.
Yeah.
You need to have a face mask.
Mm-hmm.
Right? So you can use this ampu bag here and inflate air through a face mask in case she can't breathe.
Okay. Or the face mask that going on the nose. Yeah.
Okay. So then let's just quickly talk about the nasogastric tube.
Yeah.
Okay. So how often do you give feeds?
Every 3 hours.
And how much do you give?
Approximately 60, around 200 ml.
200 ml. That's feeds or water?
That is liquid food feeds.
Are you there?
Yeah, feeds.
Feeds. And then you flush it with water?
Yeah.
Okay. How long has the nasogastric tube been in? How long has it been in for?
We recently changed it. A doctor came and changed it every month.
Every month. Okay. How do you know when you start feeds that the tube hasn't migrated into the lungs? How do you know?
Well, we usually check with the air, with the empty.
Okay.
Yeah.
So
On the
you
stomach.
check. You've got a bladder. You've got a syringe.
Yeah.
And you're using a stethoscope.
No, I use my hands.
Okay, that's very risky. That's very risky, because the risk, as much as I'm all for nasogastric tubes, the risk with the nasogastric tubes is they migrate, and they might migrate upwards, and then all of a sudden you've got feeds going into the lungs, and that could also cause her to die.
Mm-hmm.
Right? So, so you are having some super high risks here, right? Super high risks. Now, we had, I'm not sure how much research you've done. We are providing intensive care at home here in Australia. And if patients in a situation like that don't have 24-hour nursing care with critical care nurses, people have died. You're sitting on a ticking time bomb here.
Mm-hmm.
Other question. Are you the only person providing the care, or do you have other family members that help you?
Yeah, approximately two additional, yeah.
Right, but still, you are more or less, your family is looking after your mom 24 hours a day.
Yeah.
Now you are sitting, unfortunately, you are sitting on a ticking time bomb here.
Yeah.
I'm not trying to be negative.
Mm-hmm.
I'm just realistic, and from what I've seen, if you were here in Australia, we could provide 24-hour nursing care, and it would be government funded.
Right. Not here. Not in Trinidad yet. Yeah.
No, I hear you. And I fully understand why you're doing it. It's your mom, and you don't want to leave her hanging. But I also need you to be extremely cognizant of the risks that you are taking.
I am. Yeah. Well.
How far away are you from the hospital?
Probably let me say about 10 minutes.
10 minutes, okay. And have you needed to get her back to hospital since she's been home?
No.
Okay, you're very lucky. Very lucky. Do you have, when you check her oxygen, do you have her connected to the oxygen monitor all the time?
No.
How often do you check it?
Usually every time we finish our feed, like every 3 hours.
Okay. Every 3 hours. Okay. And it's always around 90 to 93.
Sometimes it might go up to 98, but most times you're looking at 90 to 93.
Okay.
Because the brainstem damage that happened from the diagnosis those doctors gave us is basically she could breathe on her own, but just not consistently.
She can breathe on. Yeah. I can see that. It's not, with oxygen saturations 90 to 93, she's also at risk of oxygen starvation for the brain. Right? And if she's at risk of oxygen starvation from the brain, that puts her at even higher risk of more brain damage.
Okay, so that's considered low. 93.
Can you say again, please?
I said 93 was considered low.
93, yeah, I would consider it low. 90 is definitely low. Is your mom, that's what I've asked, is your mom was she a smoker, or was there anything like that?
No, she was just a bipolar case, basically.
Yeah.
It was terrible.
Right. Okay. But not. Yeah. Okay. Okay. That's fine.
But nothing, nothing out of the ordinary like those things.
Right.
No smoker, no drug abuse, anything like that.
Yeah. Okay. So this is what I would so in an ideal world, okay, let's just say we would be providing 24-hour nursing care for your mom, which you absolutely need to keep your mom safe. First off, we would only send you nurses that are tracheostomy competent, that can manage that airway 24 hours a day. You absolutely need this equipment that I mentioned to you. The other thing that I'm typing in here, you need ideally a Fisher and Paykel humidifier.
Okay.
Right? I'll type this in. One of their models is the MR850. I'll just type this in here. You absolutely need that. Right? You need spare tracheostomies. You need the AmpuBag that I've shown you. You also need, ideally, a tracheostomy dilator. So let me ask you this. Do you know if the tracheostomy was a surgical tracheostomy or a percutaneous tracheostomy? Do you know what I mean by that?
Surgical, I believe it was surgical.
Okay. So that means if it was surgical, it means it must be a stable stoma.
Yeah.
Must be a stable stoma. Okay, that's good. But you are still at risk. Okay, again, let's picture the worst case scenario again, Ryan. It's 3 o'clock in the morning, the tracheostomy blocks, and your mom can't breathe. She could die in minutes. Okay, let's take another scenario. Again, it's 3 o'clock in the morning, the tracheostomy comes out, and you can't get it back in, or you don't have a spare tracheostomy. Your mom could die within minutes.
My question is as I tell you, I'm not too familiar with the tracheostomy, right? With the track. So the track could come out on its own?
Very much so. Can your mom move her hands?
Yeah.
And what if she pulls it out? Or what if you turn your mom? I'm sure you turn your mom on your side every now and then.
Yeah.
So what if you turn her on the side and it catches, it got caught somewhere, you pull it back, you don't see it, and the tracheostomy comes out. Just because it hasn't happened, doesn't mean it's not going to happen. And it is absolutely life-threatening if it does happen.
Okay. Yeah, well, as I tell you, this is like I asking you all these questions because I don't know anybody personally who have a track. So
you can see,
yeah.
you knew something's not right. You knew you need help.
Yeah. Yes.
But you can see, I'm not here to be negative. I'm just trying to manage the risk.
Yeah, well, I will try to work on getting some of these instruments you mentioned here.
Yeah. And I can certainly, we could provide training to you online how to change a tracheostomy in an emergency situation. We can certainly do that.
Yeah, sure.
What you might do is, it's probably best if you reach out to me.
Okay.
Offline. Just reach out to me, and I'll just text you. I'll just send you my email address here. Hang on. Just email me here or call me. Are you on WhatsApp?
I am.
Call me on WhatsApp. I'll text you my WhatsApp number here. So here's how you can contact me. Oh, hang on. Can you see that?
Yeah, I am. Yeah.
Just contact me there. All right. Well, if you would like to try, I can see there's someone else commenting they would like to see the training. Just contact me if you would like to have some training. Just contact me. Well, there's someone saying welcome to where. I would like to see the training. You've got my contact details here. Just contact me. I will need to be clear. We will charge a fee for the training.
For the training. Okay.
But we can talk about that offline. How much time would be involved. But your mom's life is hanging at a thread, and you need to be very cognizant of that.
Yeah. All right. So we can get into those items. What I want to really find out as well. So, is it possible that she could talk? Because right now she cannot talk, and I can see she trying to talk.
She can't talk as long as the cuff is up. As long as the tracheostomy cuff here, as long as that's up, she won't be able to talk. It's blocking the vocal cords. It's paralyzing the vocal cords.
So there's no possibility of her talking.
Not with a cuff tracheostomy, unless you can take the cuff down. Unless you can take the cuff down, or she can use an uncuffed tracheostomy. There's no way she can talk.
Uncuffed. What is the difference between the uncuffed and the cuffed? What is the advantages?
Yeah. The difference is you're using a cuffed tracheostomy if someone can't swallow. That's when you're using a cuffed tracheostomy, right? Because it prevents a patient from aspirating. And you're using an uncuffed tracheostomy, generally speaking, when someone can swallow but can't clear their airway and they need suctioning. That's the difference.
So in this case, they would have noticed that my mom cannot swallow.
Most likely. What would help if you wanted some training? What would help is if we could also look at the medical records. We probably would need to do both, because then we can guide you. I need more. I've told you about the nuts and bolts today, but in order to guide you, can she talk? What does she need going forward? We would need to look at the medical records, if that makes sense. It goes beyond this conversation today.
Okay. Yeah. I would have to get
Need to get access to the medical records.
I can't get access to it. It's just you have to put in the request to get it. Yeah.
Sure. Your mom's life is hanging at a thread, Ryan.
Okay.
All right, Ryan. I need to let you go because I've got to wrap this up.
No problem. All right. So I will message you on the WhatsApp, and
please.
Once it is within reach, I will try to do it. Yeah. Okay. Thanks so much. Yeah.
It's a pleasure. All the best. Thank you. All right. Well, that was a really good session with Ryan there. Now I've got to wrap this up now. If you want help for intensive care at home like Ryan does here, go to intensivecareathome.com. Contact us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. We are currently providing intensive care at home all around Australia with critical care nurses into the home. It's NDIS funded, TAC funded, NIISQ funded, DVA and iCare funded. So reach out to us there. We also provide level 2 and level 3 NDIS support coordination. With Intensive Care Hotline, we provide consulting and advocacy for families in intensive care all around the world. You can get more information at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. And I do one-on-one consulting and advocacy as well over the phone, Skype, Zoom, WhatsApp. We also have a membership for families of critically ill patients in intensive care, and you can get access at intensivecarehotline.com if you click on the membership link, or you go to intensivecaresupport.org directly. We also do medical record reviews in real time for families in intensive care, so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. I also talk to doctors and nurses directly on your behalf. I also represent you in family meetings with intensive care teams. Also, subscribe to my YouTube channel if you like the work that we're doing. Subscribe to my YouTube channel for regular updates and for the YouTube lives. Click the like button, click the notification bell, comment below what you want to see next. Share the video with your friends and families. And I do the weekly YouTube live every week around the same time. Thank you so much for watching. Don't forget to smash the like button and subscribe to my YouTube channel. Take care for now. So that was a really good segment of one of my YouTube lives. And, if you want to come live on the show, just join me, subscribe to my YouTube channel, or subscribe to our email newsletter here at intensivecareathome.com, so you can get notification when I do these live streams. But, the live stream was really all about, what you need to do when you have a loved one critically ill at home, which is the case with a tracheostomy or a PICC tube, or anyone that's immobile. You need 24-hour nursing care, which is also, by the way, evidence-based. If you look on our website, intensivecareathome.com, and you look at the mechanical home ventilation guidelines, you will see that, it's evidence-based to have critical care nurses 24 hours a day for anyone at home with a tracheostomy and or ventilator. So this is what Robin needs here in this situation. Now, with intensive care at home, currently we're operating all around Australia, in all major capital cities and in all regional and rural areas. We are an NDIS accredited intensive care at home nursing service. We are TAC approved in Victoria, WorkSafe approved in Victoria, iCare in New South Wales, NIISQ in Queensland. We are also a DVA, Department of Veteran Affairs approved service provider all around Australia. Our clients have received funding through public hospitals, private health funds, as well as departments of health. And we're also providing level 2 and level 3 NDIS support coordination, which is critical for most NDIS participants that are needing access to the NDIS, especially when it comes to long-term ventilation, tracheostomy care, BiPAP, CPAP ventilation at home, seizure management at home, PICC line management, central line management, Hickman's line management, etc. Also, we are employing hundreds of years of intensive care nursing experience combined in the community. I believe that is unmatched in 2024 in Australia. So we're really bringing a high level of skill in the community, most of the time fully funded by the NDIS and by other funding bodies. Now, if you're at home already, like Robin's mum, and you realize you don't have enough support, you don't have the ICU nurses that can take care of you or your family member properly 24 hours a day, or your family member or yourself is going back to hospital or ICU all the time, I strongly encourage you to reach out to us here at intensivecareathome.com, because we can help you and because we keep our clients at home predictably, and we also predictably get the funding for our clients. That's part of our advocacy. Our success rate in keeping patients at home and our clients at home predictably is very, very high. And it's also very hard to get the funding. Otherwise, we wouldn't be in business. Think about that. And if you're an NDIS support coordinator and you're looking for nursing care for your participants, please reach out to us as well. Even if you're looking for funding for more nursing care, I encourage you to reach out. We can help advocate. We can help you with the advocacy, and we also provide specialist NDIS nursing assessments. And if you are a critical care nurse and you're looking for a career change, we're currently offering jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Victoria, as well as in Warragul in Victoria. If you have worked in critical care for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care qualification, we will be delighted hearing from you. We are offering a tailor-made solution to our clients, which includes regular staff. Our clients want to have the same staff coming over and over again because they are very vulnerable, and it's all about building those critical relationships and having regular and stable teams. So if you are potentially looking for agency work where you can come and go, this may not be the right fit for you. But if you're interested in a long-term engagement with us and a long-term engagement with our highly valued clients and building those critical relationships, then this is a win-win situation for everyone. And if you are an intensive care specialist or ED specialist, we also want to hear from you. We are currently expanding our medical team as well. And if you're an ICU specialist or intensive care consultant or an ED consultant or specialist, we can help you alleviate some of your bed blocks for your long-term patients or patients that come in frequently. We can help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, please reach out to us as well. Lastly, if you're in the US or in the UK and you're watching this, we want to hear from you as well. We can help you there privately. And all of that, again, you get at intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. If you like my videos, subscribe to my YouTube channel for regular updates for intensive care at home and for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have. Like you've seen, I also do a weekly YouTube live where I answer your questions live on the show. And you will get notification for the YouTube live if you're a subscriber to my YouTube channel or if you're a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.